Hey guys, happy Friday. I can't believe it has been 1 week since I had my big surgery. The kids all just left for school. Matthew left as well, so I've got a little bit of quiet time now, so I thought I'd come on here and give a little update on how I'm doing and answer questions if anyone has questions. And then I'm probably going to take my pain medicine and go to sleep. I think actually my pain medicine might be due while I'm doing this video. So if you've got questions, I can see them. So just leave them in the comments and I'll try to answer them. Excuse me. So to just recap, in case you haven't seen one of these videos or haven't read my posts, last week Friday on December 2nd, I had major surgery. I had a breast reduction, and then I had diastasis recti, and so I did the research and found out that really the only thing that could repair it, with a 4-inch split being as large as it was to have abdominal surgery. So I had that abdominal repair, and along with that had abdominoplasty. And so I was cut from here to, my hips basically. And so it's a very major surgery. My surgery took around 4.5 hours, something like that. I have one drain that's coming out of my left hip, and I have a binder on around my stomach that I will wear pretty much 24 hours a day for at least the next 30 days. And then I have a special post-surgical bra to wear for the breast surgery. We had help. My mother-in-law and sister-in-law came down to Nashville to help for the first 4 days post-surgery. And those were definitely the hardest days. I, excuse me, was very hunched over. So when they sew your abdomen together, they pull you really tight with doing that abdominoplasty, and so you can't stand totally straight. Hey there, seeing your comments. Good morning, guys. And so that was really hard. It's very hard to get up from a sitting position or sit back down. You really can't use your core at all. A lot of people have asked, what hurts more, the breast surgery or the abdominal surgery? And definitely the abdominal surgery. Honestly, I haven't really noticed any pain in my breasts at all. They're cut on the underside of them, and so that is kind of at the top of where my core stuff begins. And so I really haven't had any pain at all with the breast surgery. At all. And one thing that a lot of people told me was that I wouldn't be able to lift my arms, but you can see I can lift my arms just fine, and have been able to lift them almost since the very beginning. So I'm grateful for that. It's really been the abdominal repair that's been very painful. For the abdominal repair, they sew your abs back together, and then for the abdominoplasty, how they get to your abs is they cut you hip to hip. So I've got one really long, I'll have one really long scar, kind of even like below my bikini line, and then the drain is coming out that left side. So I've got gauze covering all of that. And they also, for doing the abdominal surgery, make you a new belly button. So I have a new belly button, which I haven't really seen yet. They have like a special, I don't know, some sort of special gauze. It's yellow that they put in it, and then they've got like a clear plastic that goes over it. And they did remove that yesterday at my 1-week checkup, but then they immediately put that binder on, and since I don't take that off, I haven't seen it. But they said that it looked good, and so there it is. What else can I tell you about it? One thing that I thought was kind of interesting that they told me, so I've got to keep gauze covering that scar, okay, that those stitches. It's actually glued together at my hips, and so it's kind of a pain because I've got this big binder on, and then I've got gauze all the way kind of at the bottom. And so the nurses told me that actually what they have found works really well is to take maxi pads because they have adhesive on one side and then it's just padding on the other side, and you attach those to the binder, and then you've got that pad that'll really stay in place. So I did that this morning, so we'll see if I notice a difference with it. It all kind of feels sensitive. I think I was moving a little too much this morning. I don't know. So overall, I feel like I'm doing really well. The drains are, hey, Allison, love you too. The drain, so I thought I was going to have 2 and I only have 1, which I'm really grateful about. But the drain is because there's so much swelling that happens with these surgeries, and there's just lots of fluid that the drain gets all of that out. Okay, so that kind of like flushes your body. And to get the drain removed, I have to have 25 milliliters of fluid or less a day for 2 days in a row. And right now I'm at about 80 milliliters a day. Patricia, I see your comment. I'll get to that in a minute. I'm at about 80 milliliters, and so I've got a long way to go. I really thought that I would be kind of at the 10 days mark that I wouldn't have the drains anymore. My surgeon yesterday said that it's very unlikely that I will get my drain out next week, that it will probably be the following week, that there's just so much swelling that happens with everything going on. So I was really disappointed by that. Initially, he said that I couldn't shower with the drains, and surgeons kind of have different views on this. So because of the drain's goal is to suck fluid, right? So if you take a shower, that fluid could, from the shower get into the drain, and it can cause infection, and there's risk of that. And so his preference is for no showers. And so I've been using those body wipes that you can buy like anywhere. So I've been using those everywhere, and then I was standing at my kitchen sink and washing my hair. And today was actually, my hair's still a little wet, but it was the first day that I was able to do that without help today. So that felt good. Angie, you keep thinking how tough I am. Oh, you're so sweet. Thank you. I think you just kind of have to barrel through, So anyway, yesterday I was like, so I really can't shower because you guys, I'm a like shave my legs every day kind of person. And a week without shaving my legs, I feel like I'm a woolly mammoth. And he said, you know what, you can go ahead and shower. I just want you to be really careful. Shower with like your back to the shower because I don't want you letting like water constantly pouring on your breasts. I don't want, those sutures to get too wet. Blot everything really dry when you get out, and then use a blow dryer to dry things further. And honestly, like all of that feels really stressful to me. And so I think I'm gonna just keep like doing what I'm doing. I feel like I don't smell. I'm just sitting in this chair all day. I'm not gross. I'm putting deodorant on and I'm washing myself with those wipes. And so I feel pretty good about that. But this morning I did sit on the side of the tub, and Matthew said he would help me, but I felt fine doing it. I sat on the side of the tub and I, put some shave gel on my legs and shaved my legs. And so I feel like a new woman. I shaved my legs. I put lotion on. I'm got clean hair. I mean, I'm really living the dream here, you guys. So we'll see how I'm doing next week. I might change my mind with that. Katie, I see your comment that shower that I'll be thankful I did. I don't feel quite strong enough. And so I feel like I ordered a shower chair this week or today, and so it should be here this weekend. And so I think a couple more days, I think that I will I'll maybe attempt that, but I just didn't. That was my alarm for my medicine, and it dropped my thing off this makeshift stand that I have. So I think I'm going to try the shower in a couple days, but I feel a lot better today, and I think when I get that chair and have some help, I'll maybe feel better. But this morning I just felt like I wasn't ready to do it. So anyway, and then kind of the other big struggle is, so because I have a lot of pain. So even though I'm doing these Facebook Lives, you guys, like, I want you to know I'm in a lot of pain. And we're managing that pain pretty well with the medications that I'm on, but it's never, like, I never don't have pain. And all of that pain medication is making me really constipated. I hope that is not TMI, but that is a It is a big thing, particularly with the abdominal surgery, right? Because you don't want to, the constipation makes you swollen. Like my doctor could tell yesterday when I was there. And so he wants me regularly, like twice a day, he said, I should be doing suppositories if I am not having BMs. I hope this is not too gross. It sort of is gross. It's gross. But I feel like people, this was not something that anyone really told me about. Like people said, hey, you know, be sure you take some Miralax before the surgery and that sort of thing. But I mean, it's been an ongoing issue all week. So I'm doing that right now. It's not fun, but I definitely feel better. Yeah, Sarah, you said Miralax is your friend. So I asked him about that. I said, can I take Miralax every day? And will that help? And I'll tell you, part of the problem is the constipation relief makes me feel really nauseous. And he said that taking the Miralax sometimes can actually make patients feel nauseous and they throw up. And so that isn't something that we want to avoid at all costs with having all these stitches in my abdomen. So I don't know. I don't really have a great answer for it. And Melissa, I see your comment about the Young Living oils. I've got to look. I think I might have got that oil for my kids. So I'm going to look at that as well. I see your comments that you stopped the pain medicine and switched to ibuprofen. Yes, and I am drinking a lot of water because the medication makes my mouth really dry. So I'm drinking water constantly, and I'm having like lots of greens and like I'm doing all the things. It's just that medication is so much. So we're gonna try. I need to stay on the medication at least a few more days, I think. So we're just gonna keep doing that and we'll see next week. I took ibuprofen for the first time yesterday in between the oxycodone and that really helped. But managing the pain is so important. So all of that medication is making me really sleepy though. So I'm literally sleeping all day. Like Matthew leaves with the kids in the morning and then I wait for that alarm to go off that just went off and I take my medication and then basically I sleep till lunch and then he comes home around lunch and fixes me lunch and kind of helps make sure that I'm good and then he'll leave for a few more hours and go to the gym and then pick the kids up. So yeah, I'm just sleeping. Like it's so funny because my mind is for the most part here, right? And I feel like, oh, I'm home. And I'm never home during the week. I could do all these things. I could work on blog posts and read lots of books and binge watch Netflix. Like all I'm doing is sleeping. That's all I'm doing. I've watched 4 episodes of The Crown over the course of the past week. And that's literally about all the television I've done. And then I've started hand addressing my Christmas cards because that felt, I don't know. I just felt like I wanted to do that this year instead of doing labels. So yes, Julie, I agree that that's what my body needs is sleep and rest. And so that's why I'm home. That's why I'm on, sick leave from work is to recover. And so I think that sleep really is the best thing that I can do. Our friends have been amazing. I see, hold on, let me see your comment, that you use Ducalax. Yes, so I have that as well, Melissa, and so I've been taking that every day also. I mean, literally, I'm doing all the things and nothing is happening. I'm not a big tea person, and there's a tea called, I think, Smooth Move, maybe, and you guys, I even was drinking cups of that. We're doing everything here, but nothing's helping. Except the suppositories. So I guess that's what we'll do. But I'm really swollen. Yesterday was the first time at the doctor that I saw myself naked. Like without any of the stuff, all the gauze off, everything. And the transformation's remarkable, but you guys, I am so swollen. And the doctor was like, man, you got to be really careful with that constipation. We just don't want that to be an issue. Lindsay, I see your thing about the Smooth Move tea. So I only took that the first 2 days. So I'm glad to know that. But yes, I didn't. I did it just the first 2 days and then we did the suppositories. And this is so funny that I'm like Facebook Live talking about poop. But that is something that needs to be talked about if I'm like talking about the recovery process with this surgery, I guess. But I'm really glad I did it. I have wanted a breast reduction for probably 20 years, but I wanted to wait until after I was done having kids. Our insurance completely covered it, and so I'm grateful for that. And I can't believe how great my shoulders feel. Like, I have no shoulder pain. I have no neck pain, which is something that I've had for years and years. I mean, years. So that's really amazing. And I think when my abdominal muscles heal, I'm gonna have so much relief because I had that 4-inch hole. I had a lot of low back pain. And so the breast reduction was like back pain in my shoulders and neck, and then the low back pain and not being able to lift well and not be able to hold Ezra for a long time. It was really kind of impacting my quality of life. And so while it was elective surgery, in some regards, it really felt like it wasn't elective. Like, we had to do it. I'm 34. I'm like, I don't want to live like this the rest of my life or wait till my kids are in college before I take care of this issue for myself. And so I'm really thankful that we did it, and that we had the resources to do it. We saved for a good bit to cover that abdominal surgery. But man, I already know that it was so worth it. I feel so much better even with the pain. So do you guys have any questions for me? Tracy, you're so sweet. Thank you for your kind words. It's been really fun sharing this journey with you guys, and just talking through it and being open about it. It's interesting to me how many women go through one or both of these surgeries and they don't tell anyone about it, and they don't talk about it. But I think that it's something that's necessary to have that conversation, and know that you're not alone. I mean, it's very, very common. Okay. Angie, I see you're pregnant with your 4th. Good for you. Congratulations. I see, I lost who it was. Why did insurance cover the reduction? Okay. So insurance covered the reduction because I've been going to the chiropractor at least once a week for years. I have chronic daily migraines. There's all these different signs. Like, I have red marks down my shoulders and underneath my breasts from my bras. And so there were all these signs that the weight of my breasts was too significant for my body to handle, and that it was causing other medical conditions. And so because of that, insurance will cover a breast reduction. So it's pretty common especially since I was an H cup. So we're talking, there's a lot of boob there. But the insurance companies, my doctor said that it wouldn't even be a question. Like, they would for sure cover it. And so it was completely covered except for a bit of deductible that we had to meet. So there is something that I didn't know until I went into this process, and I was fine. But they want to be sure that you're not asking for a breast reduction, and the patient isn't like extremely overweight, and that if they lost weight, they maybe wouldn't need the reduction. And so there's like a percentage of how much breast tissue they will take based on your body weight. That wasn't an issue for me, but I know that for some women who are considering a breast reduction, they end up doing some sort of weight loss plan first, so that they're really at an ideal weight, so that they can say, no, the breasts aren't going to get any smaller. This is something that's medically necessary for the health of the individual. So that's why it was covered. Okay, I think I've lost a couple. Melissa, I see your comment that you are 1 year post the elective for diastasis repair. Oh, that's so good that you feel amazing. Yeah, I know that it's a long process. They said the swelling alone would take 1 to 2 months to completely go away. So I know that it's going to be a slow process. I don't know yet how long it's going to be before I can lift Ezra. I think it will probably be February. He's 25 pounds. And so that's been hard for him that Mama can't pick him up. But Matthew and Elias have been setting him on my lap, and he's been so sweet, even though it's hard for him that I can't pick him up. Okay, now I lost the comments. There we go. Okay. Patricia, what size did they reduce my cup to? I don't think I need to share the cup size that I went down to, but I will say that I am about half what I was. Angie, how did I know about the diastasis? Did you know, or did the doctor mention it? So when I had Ezra, I was up in the middle of the night and I was reading a HuffPost Parents article, and it talked about the diastasis, and I immediately was like, I have that. I know that I have that. That's it. That's the answer. And so if you go on YouTube and search, like, do I have diastasis recti? Or if you go on the Mom Creative and you search diastasis, I think I linked the video. There's a video where you lay down on the floor and you kind of like count down with your fingers and you can feel this gap. I actually did physical therapy, which is often recommended, because for a 1 or 2 inch gap, oftentimes physical therapy will help close that gap. But for one as large as mine, with it being 4 inches, there's no way that any amount of exercises could close that gap. But I went ahead and did the physical therapy so that I could show that to insurance. Ultimately, insurance would not cover the repair of it unless I had a hernia, which is oftentimes what happens. We didn't want to wait for me to get a hernia. We wanted to go ahead and get the breast reduction done. I didn't want to be put under twice and do those surgeries separate, because if I would have done those separately, I would have been out of work several weeks for the breast reduction and then, 5 weeks for the abdominal repair at a different time. And so it just felt like it made sense to do it all at once. And my surgeon said that that's very common to do both at once. The reduction and the abdominal repair. For some women, they get a lift and do the abdominal repair, or they get implants and the abdominal repair. But it isn't uncommon at all. The diastasis is also what in part contributes to the mom pooch, because when you have that big gap in your abdomen, all your organs are kind of pushed forward. And that's something that I definitely had and was very self-conscious of. And I had a lot of extra skin from my 3 pregnancies. And so doing the abdominoplasty, and with the abdominoplasty, they automatically, like it's included in it, repair your abdomen, just seemed like it made the most sense for me. Okay, what other questions? Good, I'm so glad you're gonna look it up, Angie. Yeah, so I see your comment about, Julie, about physical therapy. So, yeah, it's interesting. There is a lot of exercises that you can do, and I think if you have a small gap, I think that they can be effective. But when you're talking a 4-inch hole, the way my general practitioner described it, he said, that's like having a hole in your jeans and just expecting that if you, throw them in the dryer a couple times, you're going to get that 4-inch hole to shrink. Like, it's never going to go back together, that big of a hole. I have a friend who just went through the abdominal surgery, and she had a 6-inch hole. It's very common. My plastic surgeon said that he sees it sometimes with women who have had 2 children, but really it's that 3rd child that the abdomen just can't take it anymore and it rips significantly. One of the pieces that I read about diastasis said something like 70% of women who have 2 or more children have some sort of tear, and that increases there. Am I upside down? Hold on, I think I am. This is not a good situation, huh? Like, I ordered a tripod. I promise you, I'm gonna fix this. Sorry, the phone dropped again. Anyway, the physical therapy, I think, is an option for some if you have a small hole, but for a hole as big as mine, it just really wasn't going to get repaired. Megan, I see your comment, am I in a lot of pain? Well, I'm on a lot of pain medication. So I'm in some pain, but it's not severe when I am staying on top of my medication. The first few days were really hard, and it felt like the medication, it wasn't hardly touching it. So it's definitely a painful surgery and a painful recovery, but overall, I think I'm doing pretty good staying on top of the pain medicine. And so the pain is very manageable, but it's definitely there. Are there any other questions? I'm so sorry about the phone mishaps, you guys. I usually send a text message to my family, doing Facebook Live, don't call, but I forgot today. All right, well, if there's no more questions, I hope this was interesting and helpful. If you are a mom who's thought about, having this surgery, or people who have had it, that, just being honest about it and bringing you all alongside me, I think is really fun and neat, and I'm grateful to do it. So if there's no more questions, then I'm gonna take that pain medicine, get back to that phone call that just came in, and then probably go to sleep. So, all right, you guys have a great day. Bye.